Hi everyone, Dr. Sylvestre here. I am chatting about the best and often simplest way that you can maximize the odds of your patient having a really smooth anesthesia and therefore recovery. And you know that translates to everybody in the hospital just feeling that much calmer, right? Listen to what Nancy Brock has to say about this really important, very small little tip that can help your patient have a much better anesthetic experience.
Hey Nancy, it's good to see you. Thank you for
Same
being.
here.
So, I have heard you say that you've noticed that in general practices, sometimes the approach to anesthesia is maybe a little more complicated than it needs to be, not so streamlined. Can you
Yeah.
elaborate on that, please?
Yeah, I've observed quite a number of steps that people incorporate into their anesthesia or they remove from their anesthesia process that actually makes their lives more difficult and unnecessarily complicated without enhancing patient safety at all. And for instance, patients that arrive in the hospital in a state of agitation, immediately you know that you have a less than ideal situation that you now have to try to correct. And I believe that anesthesia starts at home in the sense that patients should come into the hospital in a calm state. And there is a way of inducing a calm state at home.
I like that approach, and a calm patient makes it much easier for the staff as well, right? Placing the catheter. So, how do you recommend, how do you propose the calm state be induced at home? What medications would you recommend?
Yeah, it does boil down to medication. I guess better living through modern chemistry comes to mind. But for cats, I like for them to receive gabapentin at home. And for dogs, I like for them to receive trazodone. But it's not only your drug selection that's important here. As a matter of fact, equally important is the timing of when the drugs are administered and making absolutely sure that the clients at home can get the medicine into the pet. So,
That makes sense. And so you talk about gabapentin for the cat, and being able to administer. And I understand, we always say no food before anesthesia. Any suggestions? How can you help the clients with that?
well, you can actually, for the cats, you can actually take advantage of the no food situation by asking owners to take the cat's food away the night before, leaving the water dish out. And in the morning, because cats are nocturnal eaters, and morning comes and the cats are hungry, and you put out for them a breakfast, a small breakfast of some kind, which is what I generally use is chicken baby food or a little bit of tuna juice or canned food mixed in with the gabapentin dose that I want the cats to. And my gabapentin dose is 20 milligrams per kilogram or 100 milligrams per cat. And so they're hungry, they will consume this food with the gabapentin in it, surprisingly. And that step needs to take place at least 2 hours before the cats get in the car to come to the hospital. So it may actually be easier for the owners to give it the night before.
So at least 2 hours before, but I'm going to say 6 hours before, 8 hours before is also okay when you say.
It's also good.
So because it is a fairly long lasting medication, as we know. Yeah.
Yes, it's long lasting, but it's also extremely slow onset.
Very nice. And
Yeah.
what about getting the cat to the hospital? Because while we're on cats, we know they're probably, they don't like to leave their homes, and car rides is not a fun
Yeah.
thing.
Yeah.
Suggestions there for the client?
Again, I find gabapentin to be my friend. And I somewhat jokingly say to people, give the gabapentin to your cat at least 2 hours before you take the carrier out of the closet.
Now that we've covered cats, tell me, what about the dog? Medication you'd recommended trazodone. What kind of dose and timing? And let's hit that for the dog too.
It's interesting, trazodone dosing, if you look in the literature at what the recommendations are, they're somewhat all over the map. And I think it's because trazodone has multiple functions. What we're talking about here today is trazodone as a tool to enhance calming quickly, and for a very short period of time. So just the peri-operative period. And my dose recommendations would be 5 to 10 milligrams per kilogram. Again, 2 hours before the dog gets the idea that he's going for a car ride. And so it's not that hard to get dogs to take medicine, not like cats.
Yeah.
And you mentioned earlier about, well, how do we manage this when we have these instructions for no food in the morning? And it's not a question of whether they eat anything or not. It's what they and the quantity that they get. So you want something low fat, and you want something that's small enough that you can get your dose of trazodone into something the size of a pill pocket.
Which are so convenient, aren't they? Those pill pockets, and
Pill pockets.
dogs just seem to love those. Cats, that's jury's still out, but
Yeah.
dogs do seem to love those. So what are the advantages besides having a calm patient coming into the hospital and a patient that the staff can work with, get an IV catheter in and not have to fight? What other advantage does having that patient come in calm bring you as an anesthesiologist, or bring to your anesthetic protocol?
Oh, predictability. I'm glad you asked that. So predictability, because the drugs that we use, we could spend all kinds of precious time figuring out what the best protocol is for a situation. But if our patient is not in a calm state, everything that we're asking our drugs to do for us in terms of rendering the patient compliant and relaxed, the drugs aren't going to work very well. And so we're going to be tempted to increase our dose. And unfortunately, increasing our dose of whatever seldom gets us to that calm state that we're trying to achieve with our pre-medication, for instance. And then for the rest of the anesthesia, you're chasing the patient. It won't settle. It will seem as if it keeps waking up because it was never just calm to start with.
And on that note, would you change your pre-medication dose protocol in a patient that comes in is sedated on medication as opposed to a naturally calm patient, maybe? Would you change your protocol?
So you say naturally calm. I'm not convinced that the patients we're calling calm are all that calm.
Yeah,
I mean, I'm taking you on an aside here,
yeah.
but we have patients that are extremely introverted, and I think they hide their actual state really well. But as a practice tip, I'll just say that what I rely on to determine whether a patient is calm or not, two things. One is when I'm taking vitals, I'm looking at heart rate and temperature, and a patient cannot lie to me that it's in a state of anxiety if I'm checking heart rate and temperature, because they'll both be elevated. The other tool that I use is I interact with the patient. The patient comes in calm on the oral drugs that were given at home. Now I still need to decide what I'm going to do with my pre-medication. So I need to test the waters. And the way I test the waters is I do a physical exam. And while I'm doing the physical exam, I sense whether or not the patient is relaxed and experiencing the handling in a relaxed state, or is pushing back, trying to get away, becoming combative and frightened. So based on my physical assessment of the patient, that's the point at which I decide what my strategy is going to be for pre-medication. And all of the pre-medication drugs that we have come with dose ranges. It's at that point that I choose which drug dose I'm actually going to reach for in order to achieve a calm patient. I cannot emphasize enough how important it is to have a calm patient from the beginning, doing whatever you have to do to achieve that, because it pays huge dividends in terms of predictability, ease of administration, ability to read your patient while it's asleep, instead of scratching your head wondering why is he not Why is he just not settling? And that just makes anesthesia so much more relaxing for the anesthetist.